Well, good morning. It looks like summer and autumn has finally left us, and maybe winter is upon us already. Yep, it's miserable. The fish are happy, as you can see, but it's miserable, it's wet, and yeah, it is what it is. Come in. Welcome to my abode again. Anyway, bit of an oddball on this. Different to say the least. Nothing to do with EVs, nothing to do with travelling with an EV. This one is about something that's happening to me on a, like I say, on a personal level. I've brought it up because I will guarantee there will be someone who is going through the same procedure. Someone who's going through the same pain. So this is all about arthritis. Mr. Ritus. His first name is Arthur. I hate the man. There's a lot of people out there that must suffer from Arthur and his shenanigans, and obviously me being one of them, I think it's only fair that I do share this because I want some response from people. I want to know how you've been coping with your ailments, i.e. arthritis. And sometimes it's not an age-related thing, may I add. Arthur can attack even the younger person, so don't relate this to 60 plus, 50 plus, 40 plus. It's a young thing as well, you know, so don't listen to me and think, oh, he's on again, the old gate's on again. No, I'm saying this to everybody out there who's suffering with arthritis. I agree, it ain't nice. Now, my mother suffered from it pretty bad. She had knees done. My sister has as well, and my dad had it, like I said earlier, in his nodules of his fingers. I would say it's got to be family inherited along the way somewhere. Like I say, I don't normally do my personal life, especially my injuries or whatever, on this YouTube of mine. So as a content creator, I thought I'd bring this one in to bring a few more people in to the fold of my channel and to get their response on arthritis. Comment below, tell me what yours is, tell me how long you've had it, tell me what you use, tell me how you sleep at night. Okay, when did I notice Arthur first getting on my nerves, Mr. Ritus? Well, to be honest, I feel it was many years ago, probably 6-7 years ago. I've now been retired, edging going on for nearly 3-4 years. So I'm trying to relate back when I first thought I got the pains, you know, in my body. Winter was always a bugger for me. In the cold climes, I started getting pains, you know, in my hands. And I put it down to what they used to call, what I still do, carpal tunnel. I can't put my hand flat any further than a certain point, and there's a gap where, you know, I can't push them out. There's always a gap on a flat, you know, level. That's because this joint and this joint are pulling together. That's arthritis of my bottoms of my hands, you know, where they meet the wrists. Nothing I can do about it. The pain goes up the thumbs here, which, you know, a lot of people get, and it's not carpal tunnel. It is definitely arthritis. Also, I have a few nubbles on my fingers, which are down to arthritis, only 1 or 2. Don't get much pain in my fingers, but there is a time when I get back on the tools, do a lot of DIY over, say, a couple of days, and then it really starts coming in, and it hurts even when I, you know, make a clenched fist. So my hands, that's when I first noticed it, like I say, a good 5-6 years ago. Let me progress from there and bring you on to the biggest issue I have with my arthritis at the moment. I've had 2 GP appointments. X-rays came back and they were crap, medium to high risk of bone collapse in the knee, down to arthritis. Obviously it's all that way. So what happens next? The operation. Am I looking forward to it? No, I'm bloody not. Do I know there's going to be pain? Oh yes. I mean, it's weird because you just take, it's just, oh yeah, I've had a few stitches, and you don't realise the pain that people go through when they have this knee operation, and I'm expecting it the same. I'm not after pity here, folks. I'm just making sure that anyone who realises that they've got knee issues coming up and it's arthritis based, get ready for the pain, because I've been told it will swell up 2 times, 3 times the size of what it is now. You have a compression bandage on there, keeping it really tight, and then once that comes off, it keeps the swelling, gets hot and hot and hotter. It's a major op to your knee, basically. It's your body saying, hey, I don't want that crap in there, where's my bone gone? Okay guys, here's the room. Nice big TV, clock. As you come in, this is what you see. A couple of chairs, nice fresh bed. The obvious life-saving equipment. That is the room I'm in for at least 1 more day, maybe 2. But yeah, not bad. So I'm expecting a lot of pain. I'm expecting my wife to go out of her way, bless her, and be a maid for me, and you know, I'll have a bell, ding 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 ding, I want a cup of tea. No, it won't. No, it won't. But yeah, she'll be on hands-on, and she knows she's going to be. They reckon that I shouldn't drive for around 5 weeks. Well, we'll see on that score. It's only if you do emergency braking that makes you not able to drive. You may have seen me, by the way, in some of my posts and videos. If you look back, I'm wearing a blue, we call it a strap-on. We always have a laugh saying, you got your strap on. No, it's not that way. I've got 2 actually. I've got one a little longer that goes down the knee, and both have got the hole in the front to allow your knee to come through, if you know what I mean. You have to buy your own as well. The NHS don't supply them, but it does aid you. It keeps it compressed. So yeah, look out for them. Like I say, you would have seen them on post. So I've got 2 of them. So back to it now, leaving strap-ons aside. What have I got to do now before I go in and have this op? Well, I've been for my pre-op, okay? Now the pre-op, which I didn't know it was going to be, I was called into this place in North Notts, and they said, oh, come, you know, you got an appointment, and I thought I would just go and see the specialist and talk about it again. But no, I got there, and there was a nurse who I spent a good 30 minutes with, and someone else after that. I was there about an hour, maybe hour and a quarter all in. I had everything done. I had blood pressure, I had heartbeat, ECG, where you get them all stuck to you, and then we're going to check everything. I was even asked, okay, and you'll love this bit, I was even asked regarding something to do with my, you know, brain power and my memory. The nurse said to me, I'm going to give you an address, okay, and a name to go with it, and then in around 5 or 10 minutes when we're chatting, I want you to come straight out with that name and address again. So I want you to remember it. And it was something like John Smith, you know, 96 Baker, High Street, whatever. And she says, so if you remember that, and she says, oh, by the way, while you're here, a couple more little tests for your brain power and your memory. Give me the months backwards from December. Easy, boom, 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 did that. Then it was count from 20, backward, yeah, easy. Now these little things here, some people will make a cock up on, because you're in a bit of, you know, a stressful environment. You've got a nurse in a nurse's outfit, so your heartbeat's going a bit more. People suffer from white coat syndrome, you know. But anyway, past it all, and she did say how fit and healthy everything came across from me to these tests, so that's good, apart from my knees crap. So this was the pre-op, all done and dusted, all results good, and this is why I got the phone call about 2 weeks later after having this pre-op. And I thought that the phone call was just to say, yeah, everything's good, you'll hear from us soon. Now, the op should happen in about a fortnight. I've got a date set for mid-October. I did cancel it twice, and never mind what anyone says about the NHS, I've had 3 chances of having this knee op, and I've said no. So waiting lists must be coming down. That's all I can say. Now I'm having this done at a rather posh NHS rented, if you want, unit in North Nottinghamshire. It's a private run hospital which the NHS take on to get their waiting list down. So I'm going somewhere nice to have it done rather than in a multi-ward. I'll have my own room, my own privacy, and I should be in for around 2 nights. Now, you might think I've been jumping the gun about talking about the op and not what's happening to me now and how I feel. How do I feel now knowing I've got arthritis in my knee and in my hands already, and I know it's going to get worse as I get older. Can you control it? Yes, you can control it a bit with some meds, i.e. dash drugs as we call them, but I'm no big med lover. I hate taking the damn things. You know, I've never been mad on meds. Even when I've got a headache, I have to be really pushed to take a couple of paracetamol. The worst parts of having arthritis, especially in your knees, is nighttime, when you're trying to sleep. I have lost so much sleep over the last maybe 6 to 9 months. It's unreal. I go to bed okay. I normally rub some ibuprofen cream on my knee. If not, I'll take a tab the odd time, like I say. And I'll guarantee you the first 30 minutes, boom, I'm off. No problem, no pain. Then I wake up, and that will be about 12 o'clock, 12:30. And then I start getting the pain. Then when you move and go to move thinking you've not got it, that's what, and your actions are like
in slow motion as you bring your knee straight.
And the only time you can get any pain relief, because you've been laying on the thing, or that's been touching this knee, or that knee's been on top of that one, is on your back. So you're on your back, you know, your legs are straight out. That is not a natural sleeping pattern to me. I sleep on my side. I never fall asleep on my back, but it's a have to at the moment to get a piece of respite during the night away from the pain. So that's where we are with this thing. So I will continue with it as I get nearer. I'll do one more little bit of filming before I end up going in the hospital to tell you what I'm having to do. And there's a regime before you go in, and I'll come up to that later. And then you will see this lovely knee, which is at the moment, look, no scars or nothing. We're all complete, all still fully KK. And I'll show you what happens and how I went through the op, and yeah, I'll catch up with it all then. Well guys, it's now just before 2 o'clock. I'm still in my robe, I've still not gone down. I've been here since 7. Oh, it's been a pain. I've had nothing to eat, I'm getting bored. I have done some editing, just put a post up there on the YouTube channel. But I've not eaten since 6 o'clock yesterday. Yeah, getting a bit pissed off now. It is what it is. Sitting here doing some editing, and all of a sudden I got this. A bit of a shock to the system, but hey, keeping the place clean. It is what it is. Well guys, latest from the hospital bed. Literally came out of surgery about 30 minutes ago, but it took 30 minutes to get me body temperature back up before they would release me out of surgery, because it went very low and my blood pressure went low. But all is good. So we are done, thank goodness. This back on still and whatever. But I'm expecting the pain to start in about an hour and a half. I cannot feel my toes, I cannot move my toes or feet. It ain't pleasant. So that's it so far. Time now, 5 o'clock. Well, here's the first meal. Nice hot spud, tuna, salad, plenty of butter, and nice coffee. I've been waiting for that. And it's now, as you can see there, nearly 5:10. So I'm gonna get this down me before the pain sets in. That leg there. Still can't feel my toes. So yeah, this is in me. Okay guys, here's a bit of a clearer picture on why they do this. Excuse the staff, it's just someone leaving. This pulsates in and out to keep your flow of blood going, so don't go numb. The suck at the bottom is purely to tell them that no, this is not the leg that I wanted doing. So if you've got that on the leg, they know it's not that one. This on the other hand is the full Monty, as you can see, all the way up top to bottom. Again, that one on the bottom there, that again pulsates all the time. I don't know if you can see it doing anything from there, but it's giving it like a, and that's purely again to keep blood circulation in them little toesy osies. Would you never look so good? So pan you back. So there we are. Time now is edging on, as you can see, for 25 to 8. So been in this position now for 3-4 hours. Been well fed, watered, you name it. So I'm feeling a lot better. Even gave me some lovely ginger biscuits and all the rest of it. So things are looking good. Like I say, pain is gradually starting to bite on that one. The one I've had the operation on. But hey, par for the course. So next report will be first thing in the morning at breakfast time. Good morning all. Day 2. It is now 6:30. Probably caught 2 hours kit last night. That's about it. Got the TV on, as you just heard. Nurses have been in, done their stuff. Yeah, everything's looking okay. Waiting for a bit of breakfast to come in now, I guess. Lots of pain off the knee last night. Like I say, probably got about 2 to 2.5 hours kit overall. I tried to stay up as late as I could. I've already had some tabs, some meds, which you can't say no to. They know what they're doing, you know. So yeah, that's where we are so far on this Sunday morning. We'll see what the day brings. Hopefully this lot here on my leg, let me just spin you around. This is all coming off today. Let's see what that brings. Well, it's 7:15, as you can tell by Breakfast TV. Breakfast has arrived. I did ask for Weetabix, I've got that. Toast, marmalade, fresh orange juice, and coffee. So yeah, I'm digging in. What can be better? Bit of Breakfast TV, breakfast in front of you, good service by the ladies and guys. There you go.
What are you going to do with it?
It's going on YouTube, and I'm putting a post together about arthritis and how I've coped with it and what I'm doing about it and all the rest of it. So this place, exceptional. Care's been beautiful.
Brilliant. That's what we like to hear.
Yes. Well, as you can see, she's oh, there you go, big white bandage underneath, folks.
Yes. Quite a big bandage, this.
Yeah, it isn't it? Right, I'll let her get on with it, and I'll show you it afterwards. And it's off. And this good lady here has just said there's no blood to be seen, so that is a very good sign. So, and now that's the thing off, and I don't wear stockings normally, kids. Don't take this as a thing. Only on Saturday night. Yes, it's good to get all this off, I must admit.
And stop this awful noise of the machine.
Oh, last night was terrible, yeah.
The whole night.
Tell me. So you can blame Arthur for this. Mr. Ritus, he's brought this on. Horrible person. Well, I think simple to do in the rounds. Like I say, all mine is off now, as you can see. So, got a sneaky feeling I may well be going home today, guaranteed. Don't know yet till the specialists have been round, obviously, or whatever. But yeah, I'm doing this for me. I can make it tinge and move. Well, here we are, dressed. Normal civvies again. The leg is, as you see it. Yeah, breakfast done. It's now 8:10. So I could be out of here for 11. I've got a few x-rays to do, see the specialist, and then I should be on my way. Everything's gone really well so far. I know what else is coming up. I was determined to get these trousers on and everything myself. Use the Zimmer frame. Yeah, who would have thought I'd be using a Zimmer frame at my age? Hey ho. I've had to be 80 plus for a touch one of those. But anyway, it is what it is, folks. So yeah, I'm now ready to be took down to x-ray and whatever and do my thing down there. Okay, final bit of the journey. Jewellery is back on. Just waiting for paperwork now, and I'm staying for a chicken dinner at 12 o'clock, which I didn't think I'd get, and a bit of pudding afterwards, which is great. So being collected at 1 o'clock or just afterwards, so that gives me an hour to lightly eat my lunch, Stay overall, brilliant. People here, excellent, very helpful. I shouldn't say I've enjoyed my stay because it is what it is. You don't enjoy your stay when you're in for an op, but overall the experience has been far better than I thought it was going to be. Yeah, I'm expecting more pain from this. I've been told what to do physio-wise. He's been and gone. Got a couple of crutches, so we'll take it from there. So last meal of the day, 12 o'clock. Out of here for just about after 1, I guess, or 1:30 at the very latest. All good. Well, guys and girls, we are back home. Crutches at the side of me here. Last night, didn't sleep great. Got about 4.5 hours out of a possible 9 or 10. But yeah, things are what they are. Again, it's pretty much swollen, as you can see. Can't have a lot of movement on that. Tried to do some exercise this morning. I suppose I've been lucky in comparison to others because I know that 1 or 2 people stayed in there for 2 nights. Just thought I'd bring you up to where we are now. I was, let's get this right, Saturday for the surgery. So Sunday, Monday, Tuesday, Wednesday, it's now like 4 days in. How do I feel? Well, I'm sleeping a lot better. The last 2 nights have been very good with sleep pattern in comparison to how I was the first and second night. They were awful. Pain-wise, yeah, you're going to get it, folks. You've had a major op. But the pain has dropped off. The only real pain I get now is when I actually sit in, say, this position, as an example, and then, you know, want to move out. Still got the old surgical stockings on there, look, as you can see. Still on both feet, by the way. You're meant to have that. They did give me an extra pair, so they'll be in the bin in the next couple of days. So yeah, everything is good. The swelling has gone down a tiny bit. It's not as painful at the top of my leg now, so that's good. I've had a phone call from the hospital where I had it done, who were very nice, saying is everything okay and blah blah blah. They did say that I would get a call, and they kept their word, just to say, you know, if anything's gone wrong or you're a bit dubious about something. And I just feel I'm so cool, very lucky. I guess there's some people go through this a lot worse than me. And I'm just looking at my knee now thinking, you've done okay out of this, KK. You know, you've not done bad at all, because there's going to be some worse. Wow. So yeah, let's just hope that in the next 4 days, when I do another recap, things are better. Oh, there was one thing. I did have a letter from the hospital, which my wife has now took down to our GP. With a date of what the latest they can take these big staples out. I reckon they'll come out next week, midweek next week, but we'll look at those when they do. Apart from that, I'm all good. Mr. Arthritis, you ain't got me as bad as I thought you were going to do. Oh, Arthur, I'll give you some of that. Good morning all. It is now day 9. I've still got the crutches ×2. I'm trying to use one some of the time, and most of the time I get away with it. I know I've been advised to always use 2 in case you lose your footing. I can see that, because the last thing you want is to be back in Dockland, you know, with a busted knee. Wow, that would be the end of it all. But I'm trying to get used, you know, just to using one, but I'm getting there slowly. Okay, alcohol. Wow, I do like a Saturday night and a Friday night drink. I don't normally drink during the week. Unless it's a nice cold lager on a hot summer's day, you know, or I'm out at a venue. But have I missed it? It has now been, I believe, since my last drop of alcohol, about 20 days. Yeah, I suppose I have missed it, but I've not really craved for it at all, so that's good. Should have moaned about it. Not really, no, because it is good for you not to be on it, but yeah, as a social drink, I've kind of tiny bit missed it. So by the time I finish actually I've finished all the actual pills, the meds. I'm still injecting myself at the moment, each side into my stomach. Every morning as soon as I wake up, you know, the wife will bring this yellow tub in, and the the row of needles and you break one off and you put it in the yellow box to be burnt and all the rest of it. And wow, I do feel and understand for people who have to do that on a daily basis all of their lives. And wow, thumbs up to you, because it peeves me off. I don't mind doing it, it doesn't hurt. You know, some people will be cringing at doing that. I'm afraid it's one of those have-dos if you have knee surgery. So yeah, be ready for that one. If you don't like needles, I'm afraid you have to do it yourself, or get the wife or a partner to do it. God only knows, but I'm doing it myself. They finish on Friday. My last one will be this coming Friday. That's the 2-week course done. So now I'm going to be, by the time Friday rolls on, I could have a night of a Friday and night session, you know. I'm not going to, because the drugs will still be in my body. So I'm going to miss this weekend as well. So by the time I have another drink, a full alcoholic beverage, you know, 3 or 4 pints in my own home with some beer nuts and whatever, and enjoy a social drink, that's going to be nearer a month before I do. So I'll basically have a month of free, zero alcohol into my body. Yeah, it ain't going to hurt me, is it? Let's face a few facts. You're going to lose a tiny bit of weight by doing it. You know, your kidneys and your liver are going to be flushed out lovely. I've been drinking water like no tomorrow. Water is a big thing at the moment, you know, and I'm going to toilet twice a night because I'm drinking that much water. We are already on day 9. It's flew by, folks. It really has. Pain is still there, obviously, like I say. So yeah, that's it so far. Good morning. It is now day 11. I had a real bad night last night of sleep. A lot of the bruising's come out now and gone very clear on my legs and getting back to normal. But there's a tiny bit of bruising coming out on the left-hand side. But I've not had the pain that I've got now around the actual knee itself, you know, the bare knuckle of the knee, where I had the replacement. Basically, yesterday there's some bruising come out here. You can't really see it. It doesn't show up very well, but this is so tender. Obviously, this is the side, and there's a bit of, as you can see there, look, there's a bit of bruising still here. But this now, all the way down this side, and then across the other side of the leg, all the way up to here, the muscle is numb. Like, you know, you've got a dead leg? That's how it feels. And again, you know, this comes off so easy, I may as well show you where we are with this. And again, no different. Still the same, folks. Yeah, let's put that back. Now, obviously NHS all the way through, but as you know from day one, I used Ramsey Healthcare, Woodthorpe Hospital in North Notts. Superb. Couldn't knock any of the staff or anything, so big thumbs up for that, for the NHS for using them for the actual surgery where I had it done. But I only stayed in there one night. Now, that is the norm, may I add. Some people do stay in 2 or 3 nights if they've got exceptional pain, or there's something gone wrong with the surgery, or it's not suiting them, or whatever, or they've got other ailments going on. But the good thing is I'm at home now and I'm doing what I want to do, basically, to a point. When I left Woodthorpe Hospital, the nurse that signed me out, she basically made sure that I got everything, load of big jammy paperwork in this big envelope, full and rammed of everything I need, including a tool to take the stitches out. It's a big stainless steel thing that they literally ram out, but we'll come to that in just a moment. So everything was going good, and I obviously she gave me all this information. I said that I don't want to come back here for my physio and all the rest of it. It'd be silly to come back to North Nottinghamshire, which was like 25 mile away. And so we decided and agreed that everything would be tried to be done in my hometown. Well, that's worked in my favour. So like I say, she gave me a letter, and she gave me a sealed letter in an envelope. She said, give that to your doctor. So on the Monday morning, first thing, the wife took the letter down, handed it in to my doctor's surgery, and within about a day I got a call and an email and everything else from the physio in Loughborough, at Loughborough Hospital, saying, we'll see you at this certain date, blah blah blah, magic. So that's the physio sorted out. So I thought maybe a day later, 2 days later at the most, I would get a call from my doctor or a nurse at my surgery to say that you can come down and have your stitches took out. Well, I heard nothing. So I went on the NHS app. Do not rely on that NHS app at all. Don't try and book anything through it or anything, because just make the phone call. What I did, I went on the NHS app. I thought, I'll do it. I'll try it. So I took a picture of this. I told them where I'm at, explanation, sent it on the NHS app to my doctor's surgery. 3 days went by. I hadn't heard anything, obviously, like I say. So I was getting a bit concerned after 4 or 5 days. So I thought, well, they've not replied on the app. They've not replied and given me a call back. So I thought, well, I have no option here to ring the surgery. So anyway, I rang my doctors 5 days in. Oh no, it was a week. And then, yeah, because I rang them on the Monday morning, exactly a week later. Of course it was, exactly a week later. So I rang them and I said, look, so I'm just checking to see where you are with this letter. It was a sealed envelope to you and my doctor, which we left with reception. Gave her the dates. I said, I've got a copy of it here. And it basically says that you would deal with everything. And she had no record of any appointment coming up or whatever, or made for me to go and have these staples out. Now, if he was a bit of an elderly person who didn't want to use the app, because it's rubbish anyway, what I said, didn't get no reply off that. And I even told the lady on the phone, I said to her, I've even tried the NHS app. I know obviously you've not seen it at your surgery. I don't know where this so-called app goes to, a third-party bloody company, I guess, working for the NHS. But she didn't answer me. She didn't say, oh yeah, we don't use it anymore, or oh, we should have done that, or whatever. Nothing. So she didn't really want to know about the NHS app, to be honest with you. So there is a thing to this story. One, do not use the NHS app as follow-up or anything to do with any surgery you get, because I've been on there since I've come out, and it says referrals. I've got nothing about my referral to that hospital for my knee op. Surgery, nothing. It's blank. It's just not worked. So please, 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 if you have knee surgery or any other surgery, do not rely on the app. And that's where we are at this stage. Yeah, okay, my worst time of night now I'm finding is between 6 and 10. I don't know why. It's when I'm sitting at 6 o'clock till 10 o'clock, I'm moving, I can't get comfortable. It's terrible. And it is still affecting me sleep. So don't come off the meds too soon. Just keep the meds up to a certain limit you're happy with, because as soon as you do, the pain will come back. Also found out that the good old pull-up socks got to stay on up to 3 to 4 weeks. Crazy, on both legs. I've had nothing done with that leg. So that's something else that annoys me, because I hate the damn things, but hey ho, I'm going to do it. If they tell me to do it, I'm going to do it. So that's where we are today. I'm going to leave it now a couple of days until after the weekend, unless something happens dramatically. And then once I've got the stitches out, I'll come back and I'll show you where we are and how it's healing and what it looks like without the stitches in, and once it's been cleaned up. So yeah, ongoing saga. Not met Arthur yet, because I'm ready to bust his ass as soon as I see him. Oh dear, Mr. Itis. Anyway, that's where we are. So there you go, staples out. Another conquest, another part of the journey done. Now, you're going to ask, did it hurt? No, it did not. I was expecting some pain from those, but gladly, no. There was a tiny bit of a tingle from one at the very end. So that's great. You know, how can I knock that? She says it's doing exceptionally well. She's not put the dressing back on because she would like to see it dry and start healing. I can actually have a shower now. I know it sounds disgusting. I've been hand cleaning myself. I'm not a tramp. So yeah, nice shower tonight. Make sure it don't get too wet. They advise not to bathe it. In other words, keep out of baths. Showers only, and a quick shower at that. And then make sure it's very dry. Now it wants bio oil all over this, so you just get rid of all this dead skin and rub some bio oil in the thing and work it from there, and that will obviously help the skin to heal. So that's what it looks like, folks, with only 8 or 9 staples, whatever you want to call them. Could have been up to 30, she says, normally. There you go. Well, that's it, 16 days. Just a big shout out to Woodthorpe Hospital up at off the Mansfield Road in North Notts, and all their staff and the surgeon that did the operation. Big thanks to one of my neighbours who I've got a card from, bless her, and she's in far more of a bad situation than I am, so thank you, Linda. And a big thumbs up to my lady wife for getting through this 16 days with me. It ain't over yet, folks. The journey's not quite there. I might do a like a second follow-up post, depending on how I feel, to show you how it's definitely 100% healed. And obviously now I've got physio for 2-3 weeks and everything else, but I can't wait to drive again, probably this time next week. We'll wait and see. So this is it, bring it to an end, folks. Hope someone gets something out of this, even if it's just, one item you take away as a positive, that would be great. That's why I did this. Otherwise, I don't show my personal life too much on YouTube, but I thought this might be useful to at least one person out there. So I'm not going to say I hope you enjoyed it, because I definitely didn't. And we'll catch you again. Please subscribe if you're not already. Catch you later. Bye-bye.